And what is HOLE-TOX?
So HOLE-TOX is a trademark name for anal Botox. My pitch is that I did not invent anal Botox. I used to work for a proctologist, and so we would do anal Botox on patients post-surgery to help them recover with chronic anal fissures before we wanted to try surgery. And so that's where I learned how to do it. There's a lot of literature on its efficacy for chronic anal fissures as well as anal spasms regarding post-surgical treatment. There's been literature on its efficacy for helping to improve the healing of hemorrhoids. Essentially what the Botox is what it's doing is that it's helping to relax those sphincter muscles so that they get more blood flow. They relieve the spasming that can happen when they are injured. Most of the Botox is going to be going into what's called the internal sphincter. That muscle is what we call involuntary smooth muscle. You do not have active control over your internal sphincter. It's not the muscle that you tell yourself to clench when you want to stop yourself from shitting. So most of the Botox goes there because that muscle can be really responsible for when you are being inserted. You'll make it past the first sphincter, you'll get into that second sphincter, which you don't have active control over. So you kind of can't always tell your body to relax it. If that muscle starts to spasm on you, the general reflex from your body is to just push out. And you'll tell your external sphincter to push out because that one you do have control over. And that's where a lot of the trouble can start to be for a lot of these guys. Okay. And that spasming, that tightening makes people more susceptible to injuries. So I really do think of HOLE-TOX as not just a treatment for chronic anal fissures and for hemorrhoids and post-surgical, but also really preventative health when it comes to people who like to receive anal sex. Yeah. Because it does help minimize a lot of potential issues that they could be having when it comes to getting a tear. Because fissures are kind of like a paper cut on your butthole. They're small and minuscule, but they can be extremely devastating to your sex life and also just to your general how you feel. Going to the bathroom and everything. This procedure is extremely predictable. I never lose sleep over this procedure. I'm never worried about it. I do 3+ of these a day. Around Pride, I do sometimes 6, 7 a day. It can get quite insane in my practice when it comes to this procedure. It's very, very popular. And I don't lose sleep over it. It's very predictable, but you are kind of assessing the patient as a whole when you're talking to them, when you're taking their intake, when you're also inserting the anoscope to inject them internally. How much resistance are you hitting? That's going to kind of allow you to see how tight this person is, so you know how to dose appropriately. If a guy is really young and fit, he's going to need more Botox than someone who might be a lot older, who might do a lot less Botox on. It's going to change in terms of how bulky that muscle is. Very muscular guys who like to lift a lot of weights tend to be very tight down there because you don't realize it. But when you are doing these deep squats and you're doing these lunges and everything, you're clenching your butthole. And so it is engaged. You're kind of doing Kegels the whole time, which can make you very tight and much more susceptible to a lot of things like hemorrhoids and fissures.
If we talk about penis filler, the benefits you see to people's lives from girth enhancement and ScroFiller, what was it called?
ScroFill, scrotum filler.
Yeah, the benefits to people's lives you see, what do people say to you?